All right. Good afternoon, everyone. Welcome to this afternoon's program. I'm Spiro Spinakis, the president of the Worcester District Medical Society, and it's my pleasure to welcome you to this program this afternoon that's been organized by our very active student committee. The Worcester District Medical Society has been very busy throughout the past few months. Recently, we held a Women in Medicine breakfast that had a panel focusing on mentoring. We had our 15th annual Cottle Lecture featuring Dr. Anthony Fauci that was done in combination with the Garland Lecture. And this evening's program will focus on anti-racism. And with the rollout of the COVID-19 vaccines, there's been heightened interest in vaccination in the general population. Our panel of four local physicians will talk about items from the AMA's anti-racism strategic plan and discuss how we might strive for health equity in the Worcester area. This educational event is a group activity where students and practicing physicians will discuss these topics and share their experiences. At this time, it's my pleasure to introduce Dr. Ann Larkin, who is the co-chair of the student committee. We appreciate all of her work and mentorship. Dr. Larkin is Associate Professor of Surgery and the Vice Provost and Senior Associate Dean for Educational Affairs at the University of Massachusetts Medical Center. She oversees the educational programs and the needs of the faculties and students across the three schools and is responsible for upholding the accreditation standards for the institution. She is a very busy breast and endocrine surgeon at UMass and is involved in many organizations such as the Worcester District Medical Society, of course, the American Board of Surgery, the New England Surgical Society, and the American of Medical Colleges. At this time, I'd like to introduce Dr. Larkin. Thank you.
Thank you so much, Dr. Spinakis. And I'm really just so happy to be able to welcome everybody here this evening. I'm just going to spend a couple of minutes introducing our panelists and our keynote speaker, but I want to start by really giving a really loud shout out to the student members of this committee that I have the real honor and privilege of precepting. It's just a very engaged group of students who are dedicated to the goals and the causes of WDMS and MMS, and they really let that shine through in all that they do. So if you could, if you're on the call, just raise your hand and wave as I call your name. Bennett Vogt is our student co-chair. He's a third-year student. Sarah Uranowski is a co-chair. She's a second-year student. Calvin Schaefer is our student vice chair. He is also a third-year student. We have Naya Chopra Tandon, who's a fourth-year student. Luis Fazan, who is a very gracious physician member of WDMS who wanted to join the committee, which we thought was wonderful. Paramesh Karandikar is a second-year student. Iha Kaul is a fourth-year student, and Trent Taros is also a fourth-year student. So thank you to all of you for the work that you do. And I'm going to dive right in now and introduce our panelists and our keynote speaker. I'm going to start with Dr. Johnson, who I believe has been delayed a bit, but I'll just dive right in. Dr. Johnson, many of you know, he graduated with a degree in chemistry from Amherst College in 1986, and he then matriculated to Harvard Medical School, where he earned his MD degree, as well as a PhD in neurobiology in 1995. He went on to complete his residency in neurosurgery at the University of Washington in Seattle, which he completed in 2003. Upon the completion of his residency, Dr. Johnson returned to Boston to join the Department of Neurosurgery at the Brigham and Women's Hospital and Harvard Medical School, where he rose to the position of associate professor. He has received numerous scientific awards, including the Sontag Distinguished Scientist Award in 2004 and an NIH Director's New Innovator Award in 2007. We were very lucky to recruit him to UMass Health in 2016 when he was appointed professor and chair of the Department of Neurosurgery. Since 2003, he has maintained an NIH-funded research laboratory that's focused on the cellular and molecular biology of brain tumors, as well as the genetics of idiopathic normal pressure hydrocephalus. He's also extremely involved in in equity for our students and is in charge of essentially leading our diversity and equity student-facing activities at the medical school. Our first panelist is Dr. Matthew Mazziello. Dr. Mazziello is a pediatrician and public health practitioner. He is a clinical professor of pediatrics at UMass and also a climate change adaptation practitioner at Yale University School of Public Health. His pediatric training took place at Bridgeport Hospital, followed by a pediatric critical care fellowship at Boston Children's. He then went on to receive his MPH at the George Washington University School of Public Health. Dr. Mazziello has led clinical and public health teams in the support, development, and implementation of clinical and health promotions initiatives, both nationally and internationally. And he has presented his work in both of those venues as well. Dr. Mazziello's international work has been both humanitarian as well as research-oriented. He has supported and led clinical and educational teams and served as visiting faculty really all over the world. These activities included providing general pediatric and critical care support for the survivors of the Indonesian tsunami. And for this activity, he received the President's Volunteer Service Award. Thank you, Dr. Mazziello, for being here tonight. Dr. Sadav Pasi is a pediatrician and has been working in private practice in Worcester for the last 40 years. He is also deeply involved in the local community. He has served as president of the India Society of Worcester, the Indian Medical Association of New England, and the Indo-American Forum for Political Education. He is also one of the founding directors of the Southeast Asian Coalition of Central Massachusetts. In 2005, he helped establish a free medical clinic to serve the underserved in our community. At the India Center in Shrewsbury, he holds this clinic and he serves still as its medical director. His work in the community has been recognized by several governors of the Commonwealth. He is an active and proud member of WDMS for the last 30 years, and he has also been a delegate to MMS since 1996. In 2008, he was awarded the Community Clinician Award by WDMS and MMS, and he's also received the MMS Senior Volunteer of the Year Award, in addition to his many other awards. Thank you, Dr. Pasi. Dr. David Rossman, a graduate from UMass Medical School several years ago, is a radiologist and associate chair for radiology at the Massachusetts General Hospital, where he also acts as an instructor in radiology at Harvard Medical School. He is committed to global health and to addressing disparities in healthcare, and he had the unique opportunity to start the first ever radiology residency in Rwanda. Dr. Rossman wrote the curriculum, he established the program, and all of this while practicing radiology and living in Rwanda with his family for 2 years. He and his family return annually to teach. As a member of the Massachusetts Medical Society, he actually started that work in 1998 as a medical student, and he served the organization in a number of capacities. He is currently a member of the Society's AMA delegation and has served as a member of the Board of Trustees, among many other roles. And despite his busy schedule, he remains quite active in all of these organizations. Lastly, I just want to recognize my co-moderator, almost Dr. Bennett Vogt. Sorry about that, Bennett. Bennett graduated from Harvard in 2017 with a bachelor's degree in chemical and physical biology and a minor in global health and health policy. He worked for 2 years in the life sciences as a consultant to the Clearview Healthcare Partners before coming to UMass Chan Medical School. While still evaluating his future career plans, he is interested in a joint residency in medicine and pediatrics. His research projects include the infectious complications of immunosuppression and bone marrow transplants, and his roles in organized medicine are many and include being the student co-chair of this special student committee. He's also the immediate past alternate trustee for the medical student section for MMS and a delegate for Region 7 of the AMA medical student section. He is a passionate supporter of students raising their voices through advocacy and organized medicine, and is one of the founding members of this WDMS student committee. So again, I thank you all for being here this evening, and I will now turn it over to Bennett for the remainder of the program.
Thank you for the introductions, Dr. Larkin, and thank you, Dr. Spinakis, for the platform. I realize I forgot to include a photo of myself in the slides, but I'll be speaking just briefly about the plan for this evening. This is a bit of an atypical event in that it's not just a panel, but our goal is really to come out of tonight with a series of ideas for how our society can create new activities and initiatives over the next 6 to 12 months towards the goal of creating a more anti-racist society and community. And we're organizing these around some of the principles that were laid out in the American Medical Association's strategic plan for health equity, as you see here on the slides, including embedding racial and social justice throughout the culture of our society and communities, working upstream to address the social determinants of health, and finally fostering an area for truth, racial healing, and reconciliation. So the way this is going to go is first we'll hear from Dr. Johnson for about 20 minutes. Then we'll transition to the breakout rooms led by the panelists who were introduced, have a discussion, and then we'll come back for about 20 to 15 minutes of share out from each of those rooms, which are co-led by a student from the committee to share the insights. And we look forward to much follow-up and clarifying what gets said at this event tonight. So with that, I'll turn it over to Dr. Johnson for about 15 to 20 minutes.
Thank you to everyone for giving me an opportunity to talk a little bit about my own experience and to discuss with you the issues of racism and anti-racism. And, you know, I would have to say that much of what I'm going to say could probably be repeated in a different form or in a different way by many, many people of color, physicians of color, scientists of color. And it's really a tale of two cities in my mind, two sides of a coin, racism and anti-racism. And as I tell you these stories, I'd like you to keep that context in mind. So many of you know that I'm actually from the South. I'm from Tennessee. I was born in the mid-'60s at the end of the baby boom. And I remember being a child in Memphis right after the garbage workers strike and later King assassination. And that was a time of great turmoil and upheaval in Memphis, which is where he was assassinated. Tremendous sorrow. Obviously, a racist act which changed the country and in some ways changed the world. And one of the ways that the world changed was that people in this country were galvanized to do something different, to make a difference. And one of the things that they did was decide to desegregate the schools. At that time, schools were either black or white, and there's still many segregated schools in this country. But it was really a matter of policy. That schools were like that in that part of the country. And so there was a decision made by people who cared and who wanted to see change to desegregate the schools. And this was done on a large scale. And I was in the first wave of students to be bused from my home school in Memphis to a predominantly white school several miles away, maybe 10, 15 miles away. And I would have to say that that was an example of that tale of two cities that I'm going to repeat over and over, right? A racist act, and then someone decides, okay, enough, let's make a change. So I was bused to this school, and as you might imagine, not everybody was happy with that arrangement, especially the whites who lived in that neighborhood. And we were often harassed, getting on the bus, getting off the bus, walking down the street. I had things thrown at me. I had, profanity, slurs, etc., from cars that were driving by and so on. But I also got a good education there. And, you know, had it not been for the decision to desegregate the schools, I'm not sure how good an education I would have gotten. I can tell you that the public schools in the neighborhood where I grew up are not very good. And so I'm grateful for that opportunity, even though I did have to walk through the fire to some extent to do that. And just as there were people who were unhappy that Black students were going to this all-white school, there were teachers at the school who were very supportive and who counteracted that hatred and that discrimination. One of them was a school guidance counselor, and there was a recruiter from a school in New Hampshire called Phillips Exeter. You may be familiar with that. And that recruiter came to Memphis. This was in 1978 or so, and asked to interview 2 students from each of the junior high schools in the city of Memphis. And I was one of the 2 students selected from my school. And after taking the SSAT and so on, there were 3 students from the city of Memphis who were accepted to Exeter, and I was one of them. So, you know, that would not have happened had Exeter not sent a recruiter whose express purpose was to recruit needy and deserving students and bring them to Exeter and to help to diversify the school. So there again, someone decided to take action and oppose some of the oppression and discrimination that was rampant at that time in the city of Memphis. And I was a beneficiary of those actions. Some people call that affirmative action, and I think that's true. They were affirmative in their actions. They didn't just wait to see what would happen. They didn't just say, okay, I won't be racist, but they actually took steps to counteract the racism that was prevalent at that time. So I'll fast forward to Harvard Medical School. You know, I decided to get a PhD when I was at Harvard, and I didn't know it at the time, but the person whom I chose for my PhD advisor was actually very involved in diversity and equity issues. In fact, he was later recognized by the National Institutes of Health for his efforts in that area. But I didn't know that, and he never told me that. I discovered that from other people and through my personal experience. It turns out he was chair of neurobiology at the time. It was the first neurobiology department in the country. Hubel and Wiesel were there. They won the Nobel Prize for their work in vision there. And he was one of the original 5 faculty who founded that department. All of the students of color who had finished their PhDs in that department, of which there were 2 prior to me, had trained in his lab. And I remember one day in the middle of my PhD sitting down to have lunch in the cafeteria. And a junior faculty person sat down across from me and began to tell me how Blacks did not deserve to be at Harvard, how we had gotten in with lower standards and were not held to the same standards as other students. So you can imagine, I was a graduate student having my lunch in the lunchroom, having this conversation with a faculty member. And shortly after that, there was an article on National Public Radio. A professor from George Washington University had an opinion piece on NPR where he asserted that minority students at Harvard did not have to pass the same examinations as other students, and that we were passed through with lesser standards, which was completely untrue, completely untrue. But this was on National Public Radio. And you know, when you work in the lab, as many of you who have worked in the lab, we often listen to National Public Radio. So I played it all the time. And I'm sitting there working in the lab, working in the hood, and I heard this come on, and it was very difficult. So we had to go to the dean's office and report this. And, you know, we all felt that this was damaging to our professional careers. Can you imagine a patient come to see you and think that somehow your training had been less than that of others? And to the dean's credit, they contacted NPR, and NPR ran a short piece the next day to say that they had spoken with Harvard Medical School, and those statements were not true. So there again, you know, there's racism on one side, anti-racism on the other side to try to undo what was being done. I finished my PhD and went on to do my residency, and there were many, many events in between all of this, which I don't have time to relate tonight. But, you know, when I joined the faculty at Harvard, I joined with a K award. The residency that I went to was one of the longest in the country. It was 8 years. And part of that time, the last year, we were appointed as acting instructors. So that's the most junior faculty level there at the University of Washington. But that allowed me to apply for a mentor training grant from the NIH and receive that. So when I finished my residency, I already had an NIH grant, and that helped me, I'm sure, to get my first job at Harvard. And over the next 10 years or so, I received numerous NIH grants and established a practice in brain tumors, which was quite active. But you know, and the guy who hired me, the chair who hired me, stepped down. He moved on, and I had another chair. During that entire time, the 10 years or so, where I had multiple NIH grants and multiple awards, et cetera, I never had a discussion with my chair about promotion. And there were other individuals who came along who had no NIH grants. They came after me and they were promoted. And as many of you know, if your chair does not back your promotion, it's very difficult to get promoted, especially if they never even talk to you about it. Fortunately, there was a departmental review, and there were some outside reviewers who came and looked at the status of the department and where people stood. And as a result of that, the reviewers spoke with the dean and advocated for my promotion. Were it not for that intervention, I probably would not have been promoted, at least not for the next few years, based on my prior experience. So there again, what I perceive certainly as at best an oversight and at worst some perhaps unconscious bias or racism was countered by someone who decided to take action. So this pattern is repeated over and over, and I could give you many more such examples. But you know, I'm very grateful for the opportunities that I have had and that I currently have, and for the role that I play here at UMass. And I can tell you that I would not be here were it not for people who were taking anti-racist steps like the ones that I've mentioned to you here to try to right wrongs that they see and improve conditions for people who perhaps have been overlooked or disadvantaged in some way. And so, you know, these are not uncommon events, and I'm sure many of these types of steps and actions you have already taken. I would just say that those kinds of steps and actions do make a difference. They make a difference for individuals. They make a difference for groups. It's hard to know at the time that you take them how it's going to play out. Right now, I'm involved in setting up some mentoring programs for students, medical students, graduate students, nursing students, and residents here at UMass. There are about 300 students and faculty who are involved in that process, all volunteer at the moment. That wasn't why I came to UMass, but that is what has developed. And my hope is that I and the other 100 faculty or so who have signed up to do this will have the opportunity to take some anti-racist steps, some anti-sexist steps to set right things that have gone wrong or that have been done wrongly, and to make a positive difference in the lives of those students whom I hope will go out and do the same. And so it can be a multiplicative effect. So I will stop there because I know we have some small groups that we'd like to get to, and I'd be happy to answer any questions that you may have.
Thank you very much, Dr. Johnson, for setting the tone for this evening and for providing some of the personal and professional context. I suppose if there are any questions, we could maybe take one or two before we go to the breakout rooms. We're just finishing getting them set up. But if not, that's okay too. If anyone would like to either raise their hand or unmute and ask Dr. Johnson a question. All right, that's okay. Oh, Iha, sorry, go ahead.
Thanks, Dr. Johnson, for saying all of that, because I feel like it's helpful to hear what you've been through and like different steps and different points of intervention that you feel have actually made a change or influenced it, because oftentimes you feel that, well, it's a big vacuum of, I don't know, stuff. How can I work on it, or how can anything change? I'm curious when you talk about like the mentoring steps that you were referring to now in this role at UMass, how do you play, like, I guess, how do you balance that with this concept that, like, yeah, I've noticed a lot of times a lot is asked of people who represent diverse backgrounds, and, you know, they're the people that have to do the mentorship, or they have to do that. How do you bring more people into the fold, people who may support everything that, you know, you're talking about, but maybe don't see their role or have never considered themselves in that? I'm just curious kind of what concrete steps could be taken towards that, if you have thoughts.
Yeah, I do have some thoughts about that. You know, most of the hard work has already been done. You know, the George Floyd episode, and then there were some other events that occurred around the same time, you know, Breonna Taylor and others, really galvanized the country, I think. I mean, it was a very graphic reminder of things that are going on around us all the time. So, you know, there was a feeling, I think, in the country, and certainly here at UMass and other universities, that we needed to make a change. So part of the trick, if you will, is to create a vehicle that people can access, that people can plug into to try to make that change. And everyone's lives are a little bit different in terms of the amount of time they have and also the degree of passion that they have. So I think part of the key is to create something that has many different levels of engagement and many different ways in which people can get engaged. And oftentimes, you know, once you start doing that, there are personal rewards that are associated with it, and that passion will grow.
I think that's an excellent answer to an equally excellent question. We're going to transition to the breakout rooms now. For everyone who registered, we've tried our best to honor the breakout rooms that you had expressed an interest in being in, or at least, very least, gave you your second choice for them. So we'll transition to those now, and the student and attending will introduce themselves and get the conversation started. You might see a notification pop up inviting you to join the room, and if you select that, then you should be added to the room. So now we're back. We have about 10 minutes left. I really appreciate the discussion that happened in my group as well, and I'll start just by summarizing a little bit about what we discussed, and then I'll ask Sarah and Iha to do the same for their groups as well. In our group, specifically, we were talking about how to work upstream to address the social determinants of health, of which race is a strong influencing factor. And we came to some really interesting conclusions about how the language that we use of public health itself is rather insular. And we speak about it sometimes in a way that doesn't allow us to actually effectively reach out to the communities that we want to reach and be able to engage in understanding what it is that they need. So we can identify the problems all day, but what we ultimately need, and I'm quoting some folks from my group directly in saying this, is that we need to foster those connections that are cultural and open-minded, and are going to be able to allow us to mutually move forward, and not just, the medical community dictating terms about what we think is the right answer. And so, we'll summarize this in activities going forward for the society, but thinking about ways that we can foster effective community conversations and connections, and support the diverse community that we live in here with immigrants and low-income families and everyone that makes the Worcester area so special, for us to do a better job of that and be on the right path. So that's what we discussed, and I think going forward, trying to maybe identify more directly some community members, some community leaders, have a conversation. Also in thinking with our public health committee that we have, might be an effective way forward. So that was our group, and I'll Sarah or Iha, do you want to speak next?
Sure, I could speak a little bit to what our group discussed. We kind of kept it a little more of an open discussion. We talked about how that there are a lot of inequities in the healthcare system, and we kind of came to the conclusion that change will happen when we see leaders in our fields make change and really stick by what they said. Because when leaders make more of words, not actions, or not any kind of effort behind their actions, it's less meaningful. And in order to get people into positions, especially people of color and women into leadership positions, we really need to start from the ground up with medical education, starting with students and residents, and retaining residents, and promoting attendings, and getting people involved from the ground up. We also talked about how sometimes the things that make the most positive change can make people uncomfortable, and we want to make positive change and kind of make these steps while bringing people together instead of dividing them, even though it is kind of asking everyone to take a step out of their comfort zone in order to come to a more equitable place in healthcare. And if anyone else wants to chime in, I know Calvin was also in our group, but that was the general gist of what our group was discussing.
No, that was a great job, Sarah.
Sorry, Bennett, go ahead.
No, I was just saying, go ahead, Iha.
Oh, okay. Well, yes, save the best for last. Sorry, Dr. Felice, we do have the best group here. We had quite a vigorous discussion, and we were lucky to have 3 solid experts, or 4 at least in our group. So it was really wonderful to hear from people with all of that experience and that wealth of organized knowledge. One of the things that I think really stood out to me that we discussed, and this was a statement that Dr. Rossman made, it was moving performative actions into real action. And I think that was sort of what the theme of our conversations were around, and how do we take some concrete steps. We talk the talk, but now move it to walk the walk. And some of the thoughts that came out of it are very similar to what everyone else mentioned. Community engagement and ways to appropriately do that. We discussed, a whole host of things, including discussion on faculty members and their responsibilities, and how, oftentimes people with diverse perspectives are the ones that are doing the work towards it. And how do we sort of balance that equation? And another quote I really liked was bystanders into upstanders, and making that transformation and realizing we all kind of play a role into that. Another thing to me that was really interesting that we discussed was sort of balancing these conversations, which can be really charged and difficult to talk about, with we had two leaders of two big organizations, and how do you bring people on board? How do you say things that not everyone is going to take the right way, and what are some kind of strategies that we could use to be honest and be straightforward, and bring people from different opinions to kind of a common consensus about what might be important. So we had some really wonderful discussion, and feel free, anyone from the group, to chime in about that too. I'm also going to send the links that Dr. Rossman sent. He sent some links about Mass Medical Society plans and or statements and policy positions. So I put that in it.
I would just add that one of them is not just the medical. Yeah, that was perfect. And I would say especially with Dr. Larkin here, one of them is the medical schools, along with the DPH and Medical Society together on that, and which I was particularly proud, because it's not just the Medical Society, it's basically the world of medicine of Massachusetts. The thing I would add is, I was really moved by Dr. Johnson's comments, and in particular, the reality of how individual small actions change people's lives. Sending a recruiter to Exeter, the dean calling up NPR and saying that's not so, or the reviewer looking at the department and saying, Dr. Johnson deserves to be promoted. Look at what's happened here, and taking action there. That's the bystander into upstander component. And if you think about our world of structural racism, and you think about police violence, or you think about inequity in maternal mortality or infant mortality or asthma or cervical cancer, or the list goes on and on and on, it can seem, because it is, overwhelming. But the ability to decide to take an action at a moment and make a difference, the decision to go into Brockton and recruit, the decision to go and make a difference. And when you see an action on a ward of somebody making a joke that is, it's just a joke, that is racist, or treating a patient differently, or ignoring a Black woman's pain and speaking to it at that moment, that's all of the different, you're changing a life right then. And yes, we should be doing things on a policy level. Yes, we should try and go and create new commissions on maternal health and equity. Yes, we should do all of those things, but taking that individual action, taking that individual action at any given moment is a really important thing to figure out how to do, because it's why there's a full professor chair of neurosurgery in front of us, who deserved to be there, deserves to be here and beyond, but might not have been if it hadn't been for people who took actions in order to give weight to the things that he'd already earned. So anyway, Dr. Johnson, thank you for your inspiration.
I just wanted to follow up on that, David, and just say, I have a hypothesis. Maybe I'm wrong. You can ask the question of why are all the people who are on this call tonight, why are you here? And I think that people who... When you encounter someone who's very passionate and very caring, and they do something that makes a difference in your life, it leaves an imprint. And that imprint then empowers you to go do the same thing. Oftentimes there are many studies which show that people of color are much more likely to be involved in DEI activities. And those activities are generally outwardly directed. They may not benefit that individual. In fact, as Marianne said, sometimes they can be quite costly to their own professional advancement, right? Because they spend so much time doing this, but they do it. And many of you, I'm certain, do this because at some point along the way, someone took an interest and gave you good advice or helped you in some way or another, and you recognize the power and the impact that that had on your life, and recognize how those kinds of acts can change the course of someone else's life. And I agree with you. We talked about allowing people to be engaged at all different levels. And we can all be engaged at that personal level, that day-to-day level, and we should not underestimate the power or impact of those actions. We can also be engaged at the policy level as well. But I just wanted to echo what you said. There's a lot of truth in that.
Thank you so much, Dr. Rossman, Dr. Johnson, for those excellent concluding remarks. I know that, we wish that we could have done this in person. I'm grateful for how we've been able to make it and adapt to this forum for this really important event, and just want to emphasize that this is just the beginning of not just conversation, but ideally action for our medical society to be taking in this area and in this space. So I thank everyone for joining tonight and for participating. Clearly, there were some very lively conversations, and I'm grateful for that, and I'm grateful for everyone for being here. So thank you.
And before we go, I just want to take a moment to thank Bennett for his leadership and Dr. Larkin for all the work that they have done to bring us all together to have this very important conversation, which I hope will continue on many different levels for all of us. I want to thank Dr. Johnson for being our keynote speaker. I have the pleasure of working with him in the operating room, and it's nice to have a conversation and hear more about your amazing pathway to where you are today. As I mentioned before, the Worcester District Medical Society is very busy despite COVID. We are preparing for the Massachusetts Medical Society interim meeting. We had our caucus last evening. If anyone is interested in a way to meet other people, to network, to learn about a variety of issues, getting involved with the House of Delegates at the Mass Medical Society is a wonderful way. I always learn a lot from the group. We also will have the Worcester District's fall district meeting, which will be virtual on November 17th. We will be presenting awards for some amazing people who work in our community. And we're also planning some events, probably virtual, of course, around the holidays to bring us all together. So again, I want to thank everyone for participating. This was a wonderful conversation, and I'm just constantly impressed with all the work that our medical students are doing for the District Medical Society. So thank you all. Have a great evening.